Hi there, I'm Pamela Ho, he's Stanley Leong, and you're tuned to the Living Room on 938 Live. Now, what do Elizabeth Taylor, Sarah Michelle Gellar, Isabella Rossellini, and Vanessa Williams have in common? Well, other than the fact that they are stunningly beautiful celebrities, well, these women suffer from scoliosis, a condition that affects the curvature of the spine. Well, according to a survey carried out in Singapore by a team of spine surgeons in 2008, it was found that 1 in 10 Singaporeans over 40 suffer from lumbar scoliosis. And the condition is, in fact, 1.6 times more prevalent in women and twice as often in Chinese and Malays than in Indians.
Well, worldwide, scoliosis strikes about 2 to 3% of all adolescents, and the condition becomes noticeably, usual, especially between the ages of 10 and 15. It afflicts more girls than boys, with an inequality of 3.6 to 1. But what are the symptoms of scoliosis? What causes it? Is it genetic? How can it be treated? Well, I'm sure you've got your own fair share of questions as well. We hope to tackle them all in the living room today. Well, other than painful surgical procedures that involve inserting rods, are there non-surgical methods of treatments that work just as effectively? Well, according to our guest in the living room today, there are. And as author of the book, Health in Your Hands, Your Plan for Natural Scoliosis and Treatment, chiropractor and nutritionist Dr. Kevin Lau proposes an alternative route to the prevention and treatment of scoliosis that is completely natural and safe.
That's right, that's good news, I think. And Dr. Lau is a graduate and doctor of chiropractic from the RMIT University in Melbourne. And he also holds a master's degree in holistic nutrition from Clayton College of Natural Health from the US. And he's a member of the Chiropractic Association of Australia, and the first in Singapore, in fact, to provide a non-surgical chiropractic treatment program for scoliosis in Singapore back in 2005. Well, with painstaking research and years of practicing natural and preventive medicine, well, Dr. Lau separates fact from fiction in his book and provides a unique approach to healthcare, which encompasses body, mind, and spirit. And he is one of the most experienced in non-surgical scoliosis correction in Singapore, treating hundreds of scoliosis patients to date. And we're indeed glad to have him as our guest in the living room couch today. A very warm welcome to you, Dr. Lau.
Thank you for having me.
Yeah. First of all, Dr. Lau, tell us a little bit about scoliosis. Exactly what is it and what is it not?
Okay. Scoliosis is actually a deformity of the spine. Usually it entails a rotation as well as a sideward bending. And when it's not scoliosis, most spines actually have a bit of a curvature. When it's over 10 degrees or a certain degree, then it's considered scoliosis.
Mm. Okay, and what would be some of the most common misconceptions people have about scoliosis?
I think the most common misconception that most people have is that there is nothing that you can do to affect the quality of your health of your spine, and that is the main reason why I've written this book.
Mm.
Now, some people would think that scoliosis would be more all about posture and the way you look, the way you stand, the way you walk. But how does it, or how can it really affect health in general?
Scoliosis actually has a far-reaching sort of effect in the sense that when people start sitting for long periods or start putting more pressure in through their back, it can lead to more aches and pains as you get older.
Right. So let's say if I have two little boys, and if they were to carry really heavy bags, and over many years, would that cause scoliosis?
Unfortunately, scoliosis isn't just purely a physical condition, and majority of the times, most people think it's poor posture or carrying heavy bags. From what I've known is that scoliosis is a lot more a deeper issue in the sense that it's biochemical, it's neurological, it's hormonal. It's a multifactorial sort of disorder. So it isn't as simple as just poor posture or carrying heavy bags.
Carrying heavy bags, but I think one outcome would be just being short like me.
Oh, me? Oh, dear.
But something that Dr. Lau did say that he said was that it's going to be about 10% deviation from what's supposed to be good posture or good alignment. Alignment, yes, yeah, that would be the word. How do you measure that 10%?
This is actually measured on X-ray. So on X-rays we can actually measure the definitive degree of the curve through a method called Cobb's angle.
Cobb's angle, yes.
Tell us a little bit about Cobb's angle.
Okay. Cobb's angle is actually a way of ruling out on an X-ray the spine and also measuring the angle of a curvature in a spine. It's actually a little hard to explain unless it's visual.
So is this x-ray done with the patient lying down or standing up straight?
Normally it's done standing up, and they normally take a full spine x-ray.
And actually, who does scoliosis affect? I mean, are there a particular group of people that are more susceptible to it?
Definitely adolescents. The most common type of scoliosis is idiopathic, and idiopathic just means unknown cause. Most of these are between the ages of 10 to 15, and like you said before, they're mostly women.
Wow. So, I mean, if let's say, is it a hereditary sort of a thing if your parents have it? You know?
Definitely. There's been clues that genetics is involved. If your mother or a sibling or a family member has it, there's about a 25 to 35% increase in chance of getting a scoliosis.
Now, when talking about scoliosis, would the symptoms be, evidence to the eye, to the lay person's, looking at someone's posture, oh, that person has a problem, that person could have scoliosis? Can we just tell straight from visual, sight, or must it be actually medically diagnosed?
Oh, definitely through sight you can see. There are some scoliosis where it's easily concealed, especially behind clothes, but there is a test out there that most schools here in Singapore actually do with kids. This test is called an Adams test. And what they do with these kids is they get them to bend forward. And when they bend forward, if they've got a curvature, the spine actually rotates and the rib kind of rotates along with it, leading to a hump that's visible.
So that was what the purpose was for then.
Yes.
I still remember bending forward.
That's
It's cool,
what it
but we
was
never
for,
knew
right?
what they were looking at.
But, I mean, doing that test, though, are there kids that actually fall through the cracks? I mean, in terms of identifying this condition in school checkups?
Okay, luckily there isn't. They're actually quite good in terms of making sure that they're going through everyone quite thoroughly in Singapore.
Okay, that probably means I don't have scoliosis then.
You want to bend forward? Probably not now, but well, of course, we hope that you're not encountering all these difficulties as well concerning posture. We're talking about scoliosis today. What is it, what it isn't, and also about treatment options available for you. And that's something that we'll really want to get a better idea of as well.
Yeah, before we actually look at the non-surgery sorts of treatment, I mean, Dr. Lau, what are the traditional methods of treating scoliosis that are currently available? And, how would this, differ from methods that are described in your book? That would be the second part of the question.
Okay.
Yeah.
Conventionally, most scoliosis are going through in 3 different stages. If it's a mild curve that's under 20 degrees, they normally recommend a wait-and-see approach, where they just observe a kid over 6 months or a year just to see whether or not it's progressing. If it's a moderate sort of curve that's between 25 to about 40 degrees, they usually recommend some sort of bracing to hopefully prevent it from getting worse. A severe curve that's over 40 degrees, they normally recommend spinal surgery. And spinal surgery involves putting in rods or some form of fusion that helps to stop and arrest the curvature from continuing.
Right, that is really invasive then.
It is, and unfortunately I think a lot of people think that even in the earlier stages there's nothing that they can do. And that is the main reason why I've created the book. The book goes through a lot of dietary means as well as exercise and also lifestyle changes that will help to maintain the health of the spine and even hopefully make it healthier.
You mentioned bracing, but is that more just to prevent it from getting worse, or can that actually reverse the effect of scoliosis?
Bracing is actually just to prevent the progression.
All right, to arrest it where it's at and stop it from getting worse.
Yes, but even bracing itself, it's quite controversial in the sense that there hasn't been a lot of evidence
and studies
yes,
put into it.
Correct.
It's funny that now that you mention it, I have a friend who just mentioned to me that she has a crooked spine. Would that mean scoliosis? And she says that she was found to have a crooked spine, but I don't see her using bracing or anything. But sometimes she gets pain when she does active sort of work at the bottom of her tailbone area.
Yes.
Would that be common problems for people who are not treated, so to say, but who live with scoliosis?
Yes, definitely. I think bracing is mainly just done during the adolescent phase when there's a lot of growth spurts. So after that, when they've gone through most of their growing, they don't actually recommend bracing, and then they are allowed to just do whatever they want to do.
Would that be dangerous, though, for them if they're not treated, so to say?
Scoliosis does still progress even as they get older, and it tends to progress 1 or 2 degrees per year.
Oh dear. I better go tell my friend that.
Yes, tell your friend, Pam. But
right.
also, of course, pointers that we can put in place ourselves in our very own lives, just so we're not bending the way we shouldn't be. And, of course, keeping, not ramrod straight. No one's totally having a perfectly straight spine. In fact, I believe the curves, a little bit of a convex on the top half of our spine, a little bit of a concave at the lower back and all.
Yes, definitely.
But we'll find out more about the spine and its makeup and all in the next part of our program. In the living room today, we're chatting with Dr. Kevin Lau, who is a chiropractor and nutritionist, and he practices at Orchard Clinic, and we'll give you more details about that clinic also later on our program. Stay tuned to find out more about scoliosis and all the treatment options available, especially those that are non-surgical in nature. This is The Living Room on 938 Live.